My reoccurring guest today is the surgeon, Dr. Kris Shewmake, and this time he's brought along his surgical coordinator and co-founder of Zen Infusion, Miss Raeann Wilson. Are you all co-founders? Did I get that right?
Well, I'm the owner of Zen Infusion and Zen Recovery Care, and he's my medical director.
All right. I've got to modify my script a little bit. Dr. Shewmake is a renowned plastic and reconstructive surgeon in Little Rock, Arkansas. Miss Wilson, along with being Shewmake's surgical coordinator, is a breast cancer survivor. Together, they have researched and experienced firsthand the healing powers of intravenous high doses of vitamins, minerals, and nutrients for post-surgery healing, cancer therapy, autoimmune disease, as well as a wellness protocol for health, beauty, and mental clarity. On their Zen Infusion website, they say, reverse the signs of aging from within, and list over 14, almost 20 maybe, IV therapy packages to choose from. Today, we will learn about the different custom-made vitamin and mineral saline packs like the Cinderella Rapid Drip, or the Superman, or the Einstein, Energizer Bunny, Skinny Dipper, Sleeping Beauty, and more. It is with great pleasure we welcome back to the table the talented surgeon, Dr. Shewmake, and his caring co-worker, Miss Raeann Wilson of Zen Infusion Therapy. Well, I'm glad I asked. I wondered, you have a really nice boss that lets you start a business. That lets you start a business in your doctor facility to help support her customers.
Yeah.
So tell us how this all came about and how y'all ended up deciding to go into this Zen Infusion therapy.
Well, it came about because I had undergone some health issues my entire life. I've struggled with autoimmune diseases. So I was looking for a clean way to take vitamins, minerals, amino acids just for health and healing. You know, we're in the beauty business, but we want to focus a lot more on health and wellness. So also for our pre-op patients and our post-op patients, I noticed just with patients that had autoimmune diseases, how much it helped to heal. They were using vitamin infusion for oncology. They were using it in the burn unit. So I thought that could be something that I could bring to Dr. Shewmake's practice that would really elevate his patient experience. They get the best surgery possible, but we want to also provide them with the best pre-op and post-op recovery. So that's how it integrated into that. We're actually the only company that has 5 specific drips designed for plastics, derms, cosmetics, and med spas as well.
Plastic surgery?
Plastic surgery.
What's the second one?
Dermatologists can use them in their clinics. Cosmetic surgeons can use them in their clinics as well. Any medical office can use the pre-op immunity booster drip. We have a post-op rapid recovery drip. We have an anti-aging drip. And then we have a laser booster and a toxin booster.
So everybody knows that I had Shewmake do my facelift because I blogged about it. I've talked about it. And people are shocked when I tell them that when I came out of surgery, your company, Zen Infusion, came over and gave me I don't know what was in the concoction, but the very first morning when I woke up, I got an IV of vitamin C.
Right. So our rapid recovery post-op drip is designed to be given somewhere pretty much immediately after the post-op period. The reason behind that drip is because it's been a long day for the surgery patient. You know, they've had nothing to eat or drink since midnight the night before. They get there 2 hours early. They can have a 1 to 6 hour surgery. Then they're in recovery for an hour. So when we send a nurse to do a post-op visit, one of the first things she's going to do is hook the patient up to a liter bag of fluids. So that's going to help flush the toxins from the anesthesia out of their system, get rid of that brain fog, but it's also going to give them vitamins, minerals, amino acids, and anti-nausea to really jumpstart that recovery process. And if you think about it, even if you don't feel good and you go to the emergency room, the first thing they're going to do is just hook you you up to a liter bag of fluid, and you start feeling so much better. So the health and healing benefits of this post-op rapid recovery drip have been game-changing for our surgical patients, I feel. Wouldn't you agree, Dr. Shewmake?
Totally, yeah. First of all, let me just say, this is her brainchild. I'm just a surgeon, right? But I have seen firsthand, and she said great ideas the whole time she's worked with me, and I mean everything from A to Z for my practice, and mainly for taking care of our patients. And so this just falls in line with all the other things she's done with regard to caring for our patients and making their experience better. So she came to me with this idea and had done all the research on it. And I looked over all the research. I basically reviewed everything she did, but this is I'm going to give the credit all to her for this. My patients and my practice have been the beneficiaries of that. And I think, I'm inherently skeptical of new things. As a physician, as a scientist, I have to be shown. So it wasn't really until my patients started coming back to me and I'd see them for suture removal or I'd check them then post-op and they'd say, oh my gosh, I had this done 10, 15 years ago, and it could have been a facelift that I had done or an operation that I had done. And they would come and say, this time it has been so much better than it was the last time. Whatever you're doing this time that you didn't do 10, 15 years ago, it's amazing. And it was all about the not only the post-op Zen recovery that you do, but also all the IV therapy. Both, they get an IV 3 weeks before, sort of an immune booster IV. They get an IV that night, sometimes even the next day, and they get post-op shots. And she can go through all the specifics of that if you need to hear that. But everything about it, it's unusual when I have a clinic where 2 or 3 of my post-op patients don't say something about the IVs. Where can I get another one of those? How soon can I get another one? And then she has all these continuing sort of programs that patients can still utilize the benefits or enjoy the benefits of these IVs. So while I would love to take credit for all this, I can't. I can't take. I'm just the surgeon who has benefited from this.
You could take credit for being open-minded.
That's true. I'll do that. Not many people would agree with you, but that's probably good.
I want to say that I did not have one bruise. I had a facelift without one bruise.
Yeah.
Which I've seen all my girlfriends after when the next day or two afterwards, and they're bruised and they don't leave the house for 2 weeks. I could have walked out of the house 3 days after, really the next day even, if I'd have felt like it, and no one would have known. It convinced me.
Yeah, that's what I'm talking about. And they convince me. It's my patients that convince me, and it's not seeing all the bruising and the swelling and seeing the energy levels back. It usually takes a month to get your energy levels back after a long anesthetic like that.
So let's talk about vitamin C in an IV. You can't absorb enough vitamin C.
Right. And also, if you're taking anything orally, you're getting like 15 to 35% of the benefits from it. And there's negative side effects from that, like heartburn and upset stomach. So, at Zen Infusion, we didn't invent vitamins. We're just doing them differently. So by taking them IV, you're getting 90 to 100% directly into the bloodstream. And something I didn't realize when, I started the company and began the research was all the medical journal reports that have been done on IV vitamins, and especially high-dose IV vitamin C. The health benefits are really remarkable. So just the fact that they use them in burn units, in oncology, for rheumatology, every category of patient, whether you're a healthy patient undergoing a surgery or you're struggling with health problems, there are amazing benefits to high-dose IV vitamin C. One of the journal studies showed while a vitamin can't cure a disease, high-dose IV vitamin C they found in oncology patients, it was putting a protective coating around the cells that are mutating and dividing. And so by taking high-dose IV vitamin C, it decreases inflammation in your body, which is the root cause of so many disease processes. So in the study, it showed that oncology patients were living longer in less pain and having a higher quality of life when they took high-dose IV vitamin C. And the oral takers, they notice no benefits of such.
And oncology is cancer patients.
That's correct. Yes.
So you're saying that inflammation is what causes a lot of diseases?
Certainly contributes to a lot of diseases. Yeah. Heart disease in particular.
Everybody's got inflammation.
Yeah.
You live long enough, you've got inflammation.
You do.
That's why everybody can benefit from IV vitamin infusion. That's why so many people are taking anti-inflammatories orally all the time, which can have negative side effects.
And so if you take a lot of vitamin C,
right,
you can have a kidney stone.
Right. So
does that happen with an IV?
That's a great question. So it depends on the makeup of the kidney stone. And of course, we do a complete health history on all of our patients. So if a patient has a history of kidney stones and they don't know the makeup of it, for instance, the one that we would want to not give high dose vitamin C would be if it's a calcium oxalate stone. So if a patient comes in and says, I have a history of them, I don't know the component, I've never had them analyze the stones themselves, then we would just give them a vitamin cocktail with either low dose vitamin C or we would keep the vitamin C out of it. But that's where the health history comes into play, and having such a smart medical director is he can look over all of the information, and we truly customize these for the specific patient. So, if patients have a history of heart disease, we want to give them taurine. They're great for nursing mothers, but we would want to leave out B2 for them or B6 because it can suppress lactation. So that's where all of the research has come into play, and a specific patient's health history is very important.
What's your history in your medical history?
So actually, I have a bachelor's degree in speech language pathology, a minor in elementary education. I've worked with Shewmake, Dr. Shewmake, for close to a decade now. And before that, I worked for a cosmetic surgeon. So I'm just fascinated by it all.
Yeah, you've done a lot of research. And for our listeners, you can go to these fast IV shops and you can get an IV. Like if you've got a hangover, which I have done, you can be out of town, put in there IV infusion, get you a quick fix, and go to that shop and they will make you feel better. A lot of people do it, like if they're in town for weddings and stuff like that, and they've partied the night before and they just want to get their electrolytes back up. So talk about the difference between what you do and those quickie, in and outs.
Right. So I love to use the analogy of car shopping. So you can go car shopping and you can buy a Malibu or a Lexus, and they're both cars, but it's completely different what you're getting. So we're kind of the Lexus of vitamin infusion, just like Dr. Shewmake is the Lexus of plastic surgery. So it is
He's over there rolling his eyes.
It's true.
It is very true.
I'm thinking Porsche, really. I'm thinking Porsche.
Always a Porsche.
Okay. Well, the best of the best. How about that? So we're doing full dosing medical grade vitamins, and I can't speak on what everybody else puts in theirs, but I can just say you can get vials of vitamins for $5 or $100. Some of ours are over $100 for a vial of vitamins. And while some clinics will put 1, 3, 5 cc's of a vitamin, we'll put 5, 10, 15, 20, sometimes 30 cc's. So it's a complete different thing that you're getting. And so that's why the research and development was so important. And for me, being a breast cancer survivor, the premise of the company is to find a way to get completely clean vitamins and to focus more on health and healing. So it's very important to me that we have the best quality vitamins. And I've even had nurses work at other clinics and say, I wanted to go, don't get it here, go to Zen Infusion because you're just getting a bag of normal saline.
Yeah. But if you can't afford it, go get a bag of saline. Any fluid's good fluid.
Kerry, we have a 199 drip too. So it just doesn't have the high dose vitamin C in it, but we do have that as well.
Well, we're going to come back and talk about all the different kinds of drips you have. When we come back, we'll continue our conversation with plastic and reconstructive surgeon, Dr. Kris Shewmake, and Miss Raeann Wilson, surgical coordinator for Shewmake and founder of Zen Infusion in Little Rock, Arkansas. Still to come, who should get an IV? Sounds like everybody. And we're going to go over all the different kinds of options you have and how to get your own cocktail made just for you. We'll be right back.
Flag season is here, and Arkansas's flagandbanner.com has everything you need to freshen up your home with a little red, white, and blue. Bunting is a great way to dress up the front of any house, porch, or fence line. Easily spruce up your yard with stick flags and garden banners, and our wide selection of decorative door hangers will make all your guests feel right at home. You can shop online or come see us in our historic showroom in downtown Little Rock, Arkansas's flagandbanner.com. We're the experts.
We're speaking today with Dr. Kris Shewmake of Shewmake Plastic Surgery and Skin Retreat and Miss Raeann Wilson of Zen Infusion Therapy in Little Rock, Arkansas. So how did you come up with these concoctions? You said you did a lot of research. So how long of research and where did you get your research from?
Yeah. So it was a year of research to get it right and just worked with chemists and pharmacists to come up with, there are certain things you can't mix with other things. And I just really wanted to take my time to get the best ingredients, the highest dosing I could.
Did something in your life happen and you were like, this worked for me so good, I've got to share it?
Well, yes, I went through treatment for breast cancer. I had been on immunosuppressives and biologics for 20 plus years, over 2 decades, and they have side effects of cancer. And so I truly wanted to look for something that was great for health and healing after I went through all those health struggles. And I just found that big pharma, these pharmaceutical companies, spend millions and billions of dollars to create all these medications to treat symptoms, but they're not healing your body. So vitamins have been around a long time. So when I went through that, I started seeing other companies around the country, not in Little Rock, Arkansas, but around the country that were starting to do vitamin infusions. So just looking at some of the medical journal studies done on it, I was like, why is no one doing this here? Like, I don't get it. We need to focus on health and healing, getting off of these medications and decreasing inflammation in our body.
Are you off any medication? Were you able to get off medication?
I'm off all of my immunosuppressives and biologics.
That you took for 20 years?
20 plus years, yes, which is amazing. And so, yeah, it's quite remarkable. I even, for the first time in decades, have been able to skip colonoscopies because I'm doing so great. My GI doc woke me up after a procedure and was like, so what are you doing different? Like, what are you doing? You look great. It's all perfect. And I said, I'm doing my high dose IV vitamin C. And she said, yes, I've read about that. Keep doing what you're doing.
How often, when you first decided to start doing this, how often did you do it? Once a week? Once a month?
So we recommend that you do a vitamin drip once a month, and we've got programs to support that.
Did you do it more than that?
When I was undergoing cancer treatment, I wish I would have had an option available in Little Rock, but that's why I developed the company so I could provide that to other people. You can do it more than that. After a surgical procedure, for instance, or before or after travel, or anytime you're not feeling good. They're great for after COVID, after the flu, things like that. Recommended dosing is 1 a month, but again, you can take them more than that if your health history merits.
So many people have long COVID.
Yes, exactly.
Have you been dealing with that with customers?
We do see that. We do have a remedy drip that has the highest dose of zinc in there, has C vitamins for inflammation, B vitamins for energy, so it helps. In the surgical practice with Dr. Shewmake, our patients do have to be healthy before they undergo any surgical procedure.
Right.
So the types of infusion, you have a $199 package. You have a $350.
Sure. So when I started the company, it was 4 years old in January. Again, a year of that was research and development, but I came up with 10 different ones. Now we have 25 different drips. We even have the 5 specific that I mentioned earlier for surgical practices or doctor's offices or health, healing, and wellness. But then we've also got some designed for patients that have medical issues, 5 for that. For instance, migraine, a certain category of migraine sufferers are deficient in certain vitamins like magnesium and B vitamins. We've got one for rheumatology to help with all the inflammation. We've got one for GI patients. You should never get a colonoscopy without doing a vitamin drip the day of your prep because they're going to overdose you on laxatives. So this is game changing. We'll give you vitamins, minerals, amino acids, and anti-nausea. It'll be the best.
The day before or the day after?
The day you do your prep. You know, when they overdose you on laxatives to prep you for the procedure.
Yes, you have to drink all the laxative and then you get dehydrated.
Yes.
So you're saying you should do an IV?
Right. Like if you start your prep at noon, you can do your vitamin drip at 10. If you start your prep at 2 or 4, do your vitamin drip the same day prior to. It is life-changing for the better.
It is.
So,
I can testify.
yes.
That is a good tip.
Yeah.
Everybody has to do a colonoscopy.
At some point.
Thank you, Katie Kirk.
Yeah.
Right.
Really. So those are just, some of our medical drips. And again, we're not pushing medications. They're mostly vitamins. We do have some anti-nausea that we do, but they're designed to help patients in that medical category.
I like this one, the Cinderella.
Yes, anti-aging. So we
favorite.
Came up with some fun names.
The names are so cute. Let's just talk about the Big Damn Rapid Drip.
Right. Yeah. So,
what is that one for? I mean, I can guess Cinderella. That's for being young. Einstein. That's for being smart. Energizer Bunny. Energy. Mommy Drip. That's if you're nursing. Painkiller. Party Like a Rock Star. That's for hangovers.
That's for a hangover. That's right.
I need that one. Remedy. That's the one I do.
Right.
I like Remedy because it's high doses of vitamin C and I have, melanoma cancer.
Right. Absolutely. So, and that's a great one. It also has zinc in it to help fight off cold, flu, and COVID. And it has some B vitamins in there for energy as well.
What about the Skinny Dipper? Does it really make you skinny?
Well, these are vitamins, minerals, amino acids. So what that has in there is MIC. So that's an amino acid that encourages the liver to burn fat instead of store it with some B vitamins for energy. So in a healthy way, it certainly does decrease your appetite and increase your energy.
What's MIC?
So methionine inosylate choline. So it's the amino acid that encourages the liver to burn fat instead of store it.
Good job, Raeann.
Yeah.
So,
A lot of words.
Twister.
Yeah, that's awesome.
And then you have the Superman.
We do. So
that's for virile. What is that? What is
Virility.
That?
Yeah,
Thank you. Is that for virility?
Well,
you taking that one, Shewmake?
Every day.
helps with stamina.
Right before every operation, I do that.
Stamina, energy, endurance.
Yeah.
So all
Like
designed
surgery.
for that.
Yeah.
That's right.
Yeah. Is the quality of the saline different at different places? Or is it all the same?
Not the
you get?
saline. Normal saline is normal saline, but the quality of the vitamins is different. So you can definitely get different quality of vitamins.
So the packages that you offer.
Right.
So I went to your website when I first started coming and doing this to your store. You had maybe 7, like you said, you've got like 20 options now.
Right.
I'm not sure that you're supposed to give a woman that many options.
I keep saying I'm going to quit doing options, but then like other doctors' offices have reached out to us to say, can you teach us to do what you're doing? Can you help us with pre-op and post-op? And so that's where the 5 came for plastics, derms, cosmetics, and med spas. I had a doctor from UAMS reach out to me for oncology patients and say, why are you not doing this? Can you not design some for that? So that's where the 5 medical came from. So people keep reaching out to me to help create different packages for that. And so that's kind of where that came from.
What's the 5 medical?
So are you talking about the bariatric, the GI, the oncology, the migraine, and the rheumatology?
Oh, those are all.
So that's the category for patients that have medical conditions. And then I've got the fountain of youth, the toxin booster, laser booster, rapid recovery post-op, and immunity booster pre-op for like plastic surgeons and cosmetic surgeons as well.
So if I go to your website, which I actually am on right now, and I click on Einstein and, you can read what's in it. vitamin vitamin B5, magnesium sulfate, zinc, vitamin B12,
methylcobalamin.
Yeah.
Oh, God, I could never be a doctor.
Yeah.
That's B12. That's
Is that what that is? And then you go over here to, let's say yes to the drip.
Mm-hmm.
I think that's cute.
So that's for our bridal packages. Instead of say yes to the drip,
Yes, so cute.
say yes to the drip.
So this is just a lot of vitamin B complex.
It is B complex, 7 of the 8 B vitamins in there. So, and that's a rapid drip that you're looking at. So these can be done in no time. I mean, they can be done under 30 minutes for sure, but sometimes 15 minutes. The $350 drips usually are a longer drip.
Mm-hmm.
But again, around 30, 45 minutes average. My favorite are anything that we run the high dose vitamin C separate, because I do have a huge binder of the medical journal reports on the benefits of that.
Why don't you have on your website your favorite?
That's a great idea. I don't know. I think I should.
You could say Raeann's favorites.
Yeah.
Well, that made me, I was wondering, do you build, when you're coming up with these packages and the cocktails, so to speak,
Yes.
you do a really good job marketing them. You know, the Energizer Bunny, the Say Yes to the Drip. They're like, you know, the medical importance for people who are like oncology patients makes a lot of sense. And that's really awesome that you provide those packages. And that makes sense in the direction you build from. But in terms of like making it for a bridal party, did you have someone come to you and say, I'm really hungover or I'm really exhausted and I have to go and I would want a drip? And then you kind of built from that? Or did you go backwards and say, this needs to be for brides?
Or I'm really stressed, because most of the wedding related things, it's about stress. So that's why B vitamins really.
Right.
Okay.
Absolutely. So Party Like a Rock Star was one of the original 10, because we've all had a hangover. I've had a hangover and needed a vitamin drip before. So that is one of our most popular ones, actually. As far as the wedding parties go, like Dr. Shewmake said, it's such a stressful time. You've got all the parties, all the events, you're running on low energy. So we have it in the rapid and the full drip, but it's just a fun thing to do with your bridal party, just even with the groom's party.
And did you come up with that proactively, saying like, oh, I bet a bunch of bridal parties would love this? Or did you have somebody come to you and say, I'm exhausted, can you give me a drip because I'm getting married in 3 days?
We were doing at that time some bridal things at the office.
At the office,
and so it made me think. Somebody said, "Why don't you have a bridal drip?" And I was like, "Well, that's a great idea." Yeah, cool. So
are the rapid ones the $199
Yes,
ones? And so the $350 packages are the hour-long ones.
they're actually under an hour. They're usually under an hour or under. But again,
they're only 30 minutes, but by the time you get in the chair and you get
that's right.
So you need to allocate an hour. You're actually only drip maybe for 20 or 30 minutes.
Yes. And we do have an IV VIP membership that I absolutely love. It's an auto subscription. So instead of the $350 price point, you're only paying $320 a month. And then you get to get your vitamin drip each month, specific to how you're feeling at that time. So if you're feeling run down, we're going to give you a drip for that. If you're feeling low energy, we're going to give you a drip for that. If you're feeling stressed, we're going to give you something with, magnesium and selenium to help with that stress level. So you don't have to pre-pick your drip, but at the end of 12 of them, you're saving so much money that you're getting one free $350 drip with a nurse that will come to you, which is huge.
Yeah. Tell everybody about that. So your nurses will come to your house.
Absolutely. We'll come to your business. We'll come to your home. I really wanted to help Dr. Shewmake. When I started working for him, I just thought he was so underrated for his quality of surgery. Like, I just saw excellence in him, and I just wanted to really promote him and his practice. It was a goal that I had to really elevate him and bring attention to the quality of surgery that he was giving to his patients. And so I went to him and said, I want to start a post-op recovery program because we don't have that. And he's kind of like, Yeah, in Little Rock, Arkansas, I don't know about that. And I'm like, well, I've watched Botched and they have it in California and Florida. Let us try it. And so we did try offering those services to our patients and they loved it so much so that other doctors now use it as well. And that's kind of the same thing with the vitamin infusion. I think it's just to be excellent in what we're providing. And it started, with surgery patients and health issues.
Necessity. The best things come from necessity. So I love the Energizer Bunny. Listen to all the stuff in the Energizer Bunny. Vitamin C, vitamin B6, vitamin B12, magnesium sulfate, vitamin B complex, carnitine, bioamino, and glutamine.
You really thought you were going to read through all that? You get it?
I got it. Glutamine.
That's it.
That's a lot. That's the Energizer Bunny.
Right.
That's the big package. So everybody should stay on so you don't have to be like me. I started doing this with you before I knew I had cancer. Shewmake found out I had cancer and he was doing some cosmetic surgery on me. He was like, that doesn't look good, Kerry. And so now, but I started doing it anyway for a wellness package, even before I knew about that.
Right.
So everybody should do it every month. Everybody should sign, if they can afford it, everybody should sign up and do it as a wellness protocol. It doesn't have to be, I've got an autoimmune problem, or I'm getting married, or I've, got cancer or whatever.
That's correct.
So I think, Kerry, the thing that needs to go along with that is that with so many people now trying to lose weight, taking medications now to lose significant amounts of weight, they're just not eating very well. They're not eating much. The volume of food, the quality of food that they eat is usually not very good, and which is why they lose the weight. So the medicines just make them not hungry, right?
Right.
But they don't really eat healthy when they do eat. They're still, or they wouldn't lose weight, right? Secondly, food these days, we've the nutritional value of a head of lettuce now compared to 20 years ago is probably 10% of what it was because we are just pushing out food in our farms so quickly. They don't rotate crops as much anymore. So they let the soil build all of its nutrients back. So if you look at the studies, and I did this back when I did research on burn patients, if you look at the studies of the nutritional value of the average, and you pick a chicken or a radish or whatever the food is, it's significantly less than it was 10 years ago and way less than it was 20 years ago, because we have different farming habits now. So even though you're eating what we would otherwise consider to be a healthy meal, the nutritional value of that meal, other than the bulk of it, is just not there. And so that's why everybody is on taking oral vitamins. Well, then you go to the oral vitamins. All oral vitamins aren't the same. You can go to, I'm not going to pick on any stores, but you can go to one store that's a discount chain, and if it says 1,000 milligrams of vitamin C, that's what's in the capsule. But by the time it gets absorbed by your body, it may be 20% of that. Whereas you can go to a really nice company that cares about how much you actually absorb, and it could be 900 milligrams or 950 milligrams of that. So that's called bioavailability. So you need to be looking at the quality of your vitamins, and it's not always the most expensive vitamins that have the best bioavailability. It could be the cheaper vitamins.
How do you know the bioavailability?
They don't want you to know, so you have to really look at it. So
it's not on the label.
No, not at all. Of course not. No, no. So you might think that you're getting 1,000 milligrams of B vitamins, but you're really getting 200 by the time it gets through your GI tract, and it has to do with everything from the fill that they put in the capsule that takes up the volume of the capsule. It could have to do with what the capsule is made of. It has to do where it absorbs in your GI tract as to how much of that you get. Sometimes, you'll know you're getting a bad vitamin when you see it come out the other end, and you should not get anything out the other side. It should be totally absorbed by your body, but it's not. So you have to be really careful picking out vitamins. So with the IV vitamins, you know exactly what you're getting, because we know exactly how many milligrams of vitamin C or how many milligrams of vitamin B that's going in there, and it's all absorbed because it's in your bloodstream already. When you take it orally, it has to go through your stomach, get broken down into your small intestine, large intestine, some depends on what vitamin it is, gets absorbed in different places. It depends on if you take like fat, anything fatty with it. Some vitamins require you to have fat in your diet.
Really?
Yeah. Vitamin A, D, E, and K are all the fat-soluble vitamins. If you don't take them with fat, then they don't absorb. So they come out the other side.
Yeah. So if you're not eating already and then you're taking oral vitamins, your uptake's already down. Yeah.
You're right. And so not only is it's the good news is it's weight loss, but it's very unhealthy weight loss.
Mm-hmm.
Which is why you rebound.
Yeah. And so while they're losing weight, they're not really healthy. So when I have patients that come in for surgery after they've lost 40 pounds, we look at their total protein levels, their nutritional parameters in their bloodstream, and they're all down. So when your protein's down, you don't heal well. When your vitamins are down, you certainly don't heal well. All of our laser patients now, I'm doing a lot of laser resurfacing of the face. We start giving them the laser drips, and we give them chromium, magnesium, zinc, all the trace metals that are really required for healing well. And it's been amazing to see, I haven't always done laser with vitamin infusions with my lasers. We've just recently started that. They heal so much better.
Really?
They do. So much quicker,
well, that's one of the reason why I don't want to do it with my skin. I don't want to be homebound for 2 weeks.
Yeah.
Because you peel so bad and you can't really go anywhere. So they're getting.
Yeah. It's more like 8 or 9 days now instead of 2 weeks. Still not, it's not quick.
At least 1 week instead of 2.
And that's the laser booster drip too. It's high dose vitamin C. That's the one that I was talking about previously, that they do it in a lot of the burn units.
Right.
So it's just really helping edema. It's helping cellular turnover. It's helping tissue repair. And, a lot of these deep lasers that Dr. Shewmake does is taking off the layers of the epidermis down to the dermis. And so you're going to really see a faster regrowth of everything and less swelling, less redness.
Yeah.
And it doesn't fight with the cancer therapy you might be taking or other medicines because it's all natural.
Well, again, if we've got a patient that has a cancer diagnosis or any health concern that our medical director and our nurses are not comfortable with, we're going to get approval from the oncologist or the GI doc or anybody, like that. Some doctors believe in it. Some oncologists are all for it. That's kind of where it started, one from UAMS, but some are not. And we're very respectful of that. The patient needs to follow the advice of their treating physician. And so we're going to leave that up to them.
But you've never seen anything bad happen from it.
No.
I have not at all. But
this is just strictly that the doctor might not be educated.
It's a matter of
courtesy
and respect for the doctor that's actually taking care of their cancer treatment. Mm-hmm. And so we're not going to do anything that's going to interfere with that. Even if we believe it works and they don't, we still, we just have to say, I don't think your oncologist really wants you to get
tell
these
the
drips.
Patient to change doctors.
Well,
yeah. And it's funny. I had one doctor I was talking to one time getting some information, and he's like, I just don't know much about vitamin stuff. And I've heard about all this. I don't know. I don't believe in vitamins. I was like, okay, well, we absolutely respect that. Maybe when your patient is done with treatment, then they can follow this protocol and, get back with us. And he's like, yeah, absolutely. That's fine. I said, okay, do you mind if I ask you a question? And he's like, no, sure. What? I said, do you take vitamins every day? He's like, yeah, I take a multivitamin. I was like, okay, well, that's really interesting because you are taking vitamins and you're a believer in them. This is just a different way for your patient to take them. And you're just getting a small percent of that. And so he was like, well, no one's ever put it to me that way before. So I think a lot of it is just a mindset, but you may believe in it because you take them every day, but just not think of taking them in a different way.
Mm-hmm. I'd have to tell you, the first time I took one, I think it was 1.5 years ago, I felt like I was on speed or something. I had so much energy. I had no idea. I was so dehydrated.
Right.
We were all pinching the skin on the top of her arm. Like, wow, look at that.
Yeah. It was so good. I was like, I am in. I signed up for the everyday package every month,
Yeah.
But I have to tell you, I must be hydrated pretty good now because I don't ever get those big rushes like that ever again.
Right.
Now I'm just kind of normal all the time. But
Well, it kind of depends on where you are, what you've had to eat eat before, how hydrated you are, honestly, alcohol
I must have
intake.
been low.
So many things.
Yeah.
Yeah. So that's what's really good is you are on a protocol. So it's keeping your vitamin levels high. So,
I have not
that's a
been
good
sick.
problem.
I have not been sick with any flu or COVID
Yeah.
or cold
Yeah.
since I started.
Yeah. They're kind of amazing. And we also have a sublingual drop too, as well, Kerry. I don't know if we've
Is
talked
that the
about
one that goes under your tongue?
Yeah, it goes under your tongue. So it's not as good as an IV vitamin because that's going right into your bloodstream. So that's the best of the best. Our weekly vitamin booster shots, I would say, are second best because they're into the muscle, into the bloodstream. We do have 4 of those we recommend weekly, but the sublingual drops go under your tongue. So they're better than an oral pill because they do bypass first round of metabolism through the liver. And they're called toxin booster because there was a study done on patients who do like neuromodulators, neurotoxins, Botox, Dysport. 92% of patients that supplemented with zinc and phytase, the enzyme to break zinc down in your body, their neurotoxin duration was 30% longer. So that's just kind of a win-win.
What does that mean? What is she saying? She's speaking gibberish.
She's saying
to
that
me.
your Botox will last longer if you do zinc and phytase.
Oh.
So instead of 3 months, it might last 4 months.
Right.
Oh.
And they did a study on it. So they did a
Right.
study that proved
This
that.
is published in our journal, yeah.
Right. And we also put methylcobalamin in there, the highest quality, strongest, longest lasting B12 vitamin as well for an energy boost.
Here, I can translate for you if you need me to
Okay,
translate.
thank you. That's why you're here. All right, this is a great place to take a break. When we come back, we'll continue our conversation with plastic and reconstructive surgeon Dr. Kris Shewmake and Miss Raeann Wilson, surgical coordinator for Shewmake and and founder of Zen Infusion in Little Rock, Arkansas.
Our grandfather served his country during World War II. We use grave markers and stick flags to honor his memory. To those who serve, thank you from all of us at flagandbanner.com.
We're speaking today with Dr. Kris Shewmake of Shewmake Plastic Surgery and Skin Retreat. And with him is Miss Raeann Wilson from Zen Infusion Therapy in Little Rock, Arkansas. If you're just tuning in, you might want to go back and listen. There's some great stuff about how important IV infusion with vitamin C is and other nutrients and minerals, that you get 90% more effectiveness with an IV infusion than you do through taking pills or other ways of getting your vitamins. So now we're going to talk about laser and Botox booster drips and drops. And we talked a little bit about how you can get the toxin and put it under your tongue and
Not the toxin, but the
vitamin
but
drop.
the vitamin drops.
That
Yeah.
helps.
what's it called? I thought it was called a toxin.
The reason it's called toxin booster, really it's a vitamin booster drop, but it's called toxin booster because patients who are getting neurotoxins, neuromodulators like Botox and Dysport, there was a study done that showed in 92% of those patients that supplemented with the zinc and phytase, which is the enzyme to break zinc down in the body, their Botox and Dysport lasted 30% longer, but ours also has B12 in there for energy. And so I think patients love it for that reason, but they also love it because it's also just a cold flu COVID fighter with an added energy boost. So you can have it for either reason. And these are daily use sublingual drops.
So to be your best patient, I would every month come and get my IV infusion, and I would pick from your list on your website. I like the remedy because it's got a really high dose of vitamin C. I think the first time I started coming to you, I did Einstein because I felt like I was in brain fog all the time, and it worked.
Right.
My husband has rosacea. I got him to come with me, and he picked one for skin. I think it's called maybe something about
Fountain of
maybe
Youth.
the Fountain of Youth. He takes the Fountain of Youth.
I don't remember, but he looks really good.
He was back to taking, his rosacea had gotten so bad. He was at stage maybe 3. He was starting to take antibiotics every day, put cream on his face. He was still breaking out all the time and with acne. One IV infusion and it's gone. He now has doing it every month. And when he skips a month, it starts to come back.
Right. You can really tell a difference. If you skip a month, I can tell a difference physically in how I feel. But we do recommend daily drops, weekly shots, and monthly drips. It's super easy to remember that way.
Daily drops, weekly shots,
and monthly drips.
And monthly drips.
Very
That's
good.
right.
See, that Einstein worked. It's good.
I do them all.
Yeah.
I love all of that. And I am surprised that dermatologists are not recommending this IV drip for all kinds of skin problems. My 90-year-old father-in-law has had a itchy skin rash on his skin for 2 years. He puts topical creams on it, can never get it to go away. He comes to IV infusion. He gets an infusion.
And it's some kind of neurological disease. So it's not just a rash. It's not it's not a histamine response, right? It's something neurological. That's why it can't go away.
I don't know.
Okay.
I think it's because he just doesn't have enough fluids in his body. He's
sure.
90-something years old.
Yeah.
You can't drink enough water at 90 years old to put the water in your skin that you need.
Mm-hmm.
And I'm surprised that his dermatologist, who he finally just said, well, you're 90, just learn to live with it. He cannot sleep at night. He scratches himself so much. He's learning to live with it. But he comes to you and it's almost gone.
You know, a lot of people, if they have not witnessed that, especially physicians, would say, I don't know about that. There's probably a lot of other factors at play. There may not be, but I think these dermatologists may just be unaware.
Yeah. Don't say ignorant, but just unaware.
No, I'm not saying ignorant at all.
Just unaware.
Totally unaware of some of the things that we've seen.
Which is why we wanted to have the show, because you guys are caregivers and you really do care and you want to spread the good news about this.
Right.
I would love to do a study or have a dermatologist who sees these skin conditions all the time, do a study, put half his patients on vitamin C or whatever the IV drip for that treatment would be. And just see if they could see a difference. Because sometimes you just can't quantify these things. But I can't quantify. I couldn't quantify how it would benefit my surgical patients before I actually saw it. And then it was them convincing me. It wasn't anything that I saw. It was they're like, oh my gosh, this is the second one of these I've had by you, and it's just been a whole different operation, a whole different experience. Better.
Mm-hmm.
So.
And I do
every week I hear it multiple times.
Mm-hmm.
And I do think we're going to see more doctors coming around and start integrating this into practice.
Mm-hmm.
And that's kind of why the reason that we've got this new consulting program through Zen Infusion. I want to help other doctors focus more on health and healing. And they don't have to reinvent the wheel because I've already done all the research and know how to do it. So I think we're going to see it a lot more as just part of a care regimen for whatever it might be.
So this is my second time to interview Shewmake, Dr. Shewmake, and I listened to the other one that's back in the early days of my show.
That's when we were live. Then.
We were live that day.
Oh boy, were we ever?
And it's hard.
I wasn't even present, but yeah,
it's hard. It's hard for me to listen because that was 7 years ago or something. But anyway, I'm a much better interviewer today. I just want everybody to know. But you spent 10 minutes, passionate, Shewmake, talking about how much you love surgery and how you were mentored and how your father died when you were young, and you had these mentors that were secondary fathers to you, and it made such a difference. And that's why you think that you are such a teacher at heart, because you had these great mentors in your life.
Yeah, most of the most important men in my life were teachers, and who taught me. And so, of course, that's something I want to pass along. And
so teaching, you do have a teaching arm to this Zen Infusion. Talk about that.
Well, mainly the people that I teach about Zen Infusion are my patients. I can, because patients are inherently skeptical too. And I'll say, they're like, why would I need to do all this stuff? I say, well, I think it's important because, and I give them all the reasons why. And, they'll, most of them will listen to me. And then I teach other doctors, I get doctors that call me and say, hey, I saw this website, I saw your name on it, tell me how this works. And so, she actually gets invited to go and set up other offices, certain plastic surgery offices with the same sort of thing. Not only the IV infusion stuff, but the Zen Recovery, which she hadn't really even talked about. But so it's been a huge thing for my practice and for my patients. And I share that with a lot of my friends who are plastic surgeons around the country.
So you're teaching your competition?
No, well, these are guys in other cities. We're not teaching anybody in Little Rock. It's all top secret.
Right. Just because, again, I think it's so important for doctors who are open to focusing more on health and healing. We're in the beauty industry, but health and healing is super important.
What did you say we haven't talked about Zen Recovery?
Right. That's right.
I thought we did it at the beginning. What is
well,
there?
a little bit, but
So Zen Recovery is just post-op nursing. So it can be for any surgical patient. They can have total hip, total knee, heart cath, whatever. And we will provide one-on-one nursing care.
And you'll come to their house.
So we prefer to do it in a hotel setting, so it's not in the home, but we also do in-home as well, one-on-one nursing care. If you've had a surgical procedure in general anesthesia, one of the requirements is that you have someone with you, an adult with you for the first 24 hours. So we're able to provide that for patients who might not otherwise have that. And it's called Zen Recovery Care. So it's a whole package that we give them flowers and Sprite and water and crackers and soup and Miralax, all the things, throat lozenges that you would need after surgery, as well as one-on-one nursing care.
So I'm about to go in. I'm not using Shewmake. I'm about to go in and have a surgery from another doctor in another place. And I've listened to this radio show and I think I'm going to call Raeann at Zen Infusion and I'm going to talk to her about recovery and what I could get. And so I call you up and I say,
I'm going to get my hip replaced.
I'm going to get my hip replaced. And what's the first thing you ask them?
So, well, we will have to get the post-op instructions. So, in Zen Infusion, there's a part on our website, zeninfusionivtherapy.com, that you can go to Zen Recovery. So there's different packages, but we have to get health history, date, time of surgery, and post-op instructions. So once I set the patient and the nurse up, the nurse will actually follow up with that clinic to get specific post-op
and
instructions.
That's your nurse.
Zen Recovery's nurse. That's correct.
So the patient needs to go to your website and pick the package they want.
That's
and
correct.
You will help guide them to the package.
We set it all up for them. Basically, all they have to do is show up to surgery with nothing to eat or drink after midnight, and we take care of the rest.
And then because you have set it up with their surgeon and with their nurse, your nurse does everything with their nurse. Well, when I had my facelift with Shewmake, you're right. We had to stay in a hotel the first night. My sister had to stay with me, and a nurse came in and gave me the IV, and it was suddenly I'm awake. I'm ready to go home.
Right.
No bruising. Everything was great. If anybody's planning any kind of surgery, I highly recommend this recovery.
Right.
Well, it's interesting, and I've learned this about husbands, which I never knew, but husbands are not always good caregivers.
Really?
Yeah. No, surprise.
Yeah, no, you don't say.
But a lot of times these patients don't want to. They either don't trust their husbands to do it, or they don't want to put the stress on their husbands. It's very stressful it's stressful for men to go in a grocery store and buy groceries, much less take care of a post-op patient, right? Their wife. So, and they don't want to bother their friends, and they don't want get their kids involved. So they're sometimes they worry more about who's going to take care of them that night than the surgery. And she recognized that very early because she's the one that talks to all my patients after we decide to do surgery. And so she's like, I really think that there's a need for having someone arranged that can just stay with them, and it's. There's overnight packages. There's 3-day. We have patients from out of state that come in. They'll stay 5 or 7 days.
You mean your nurse will stay with them for 3 or 5 days?
Well, she spends the first 24 hours with them. Actually, the way we have it set up is the first 28 hours. She can even give them transportation from surgery. The 4-day package, she's not with them one-on-one all day, every day, all night, every night for 4 days, unless they specifically want that. And some of them do. But after 28 hours, she comes like twice a day to do drain care, medication schedule, bandage check, all the personal care needs. So she'll come AM and PM visits until the final day. And with Dr. Shewmake's patients that do facelifts, which he kind of specializes he specializes in that. He's kind of known as the face guy
Yeah.
in Arkansas. They have a head wrap on until the 4th day after. So that's why I created that package. So she'll unwrap them, help them get in the shower, dressed, packed up, and ready to go home. So they look more like themselves when they leave instead of like they've just had brain surgery.
Well, that is good.
Yeah. It's interesting. At first we tell them that this is what, I want everybody to stay in the hotel that night because patients get home, they take their medicine, their happy medicine and their pain medicine. They're like, invincible then. And so they're like, well, the kitchen, the pantry was dirty.
And that's me.
Yeah.
Oh, yeah.
And so there's nothing you can do in the hotel room except just lay there or sit on the couch. And both those are okay with me. But I can tell you how long have we been doing that? 7 or 8 years?
Yes.
Yeah. So I've been doing surgery 32 years.
Zen Recovery. About
It's
8
7
years.
or 8 years old?
Yeah.
Recovery, not
is.
infusion.
Not
They're
infusion.
different.
Oh, okay.
Yeah. I have way fewer wound healing problems or blood collections, around the face when they just don't get up and do anything.
Right.
And at home, their husbands are there or their husbands are asleep and they're up doing stuff and
Or like
you get
me, I took all my pain medicine and don't remember it, don't know it. Had
That's
to call you.
perfect.
Yeah.
Right. Yeah.
And I think they were looking for it and they were like, where's the pain medicine?
Right.
Oh, I remember that.
But
I don't even remember taking it.
Yeah.
I must have been taking it all just like
Yeah.
constantly.
But the point is, Kerry, it was hard to convince them that they needed to do that. Patients would say, look, I just live 5 minutes from the hotel. Why can't I just go home? And then, of course, they did it kicking and screaming, most of them. And then they'd come back like a week later and go, oh, my God, I am so glad I did that.
Yeah.
Wow, I am so glad I did it. And now we have patients that come in and say, now, will I get to stay in the hotel that night and kind of get those IVs? And yeah, you can.
And room service?
Yeah.
Right.
Yeah. We even had a patient the other day that said, I think I want to do that 3-day package. I don't even want to have surgery. I just want to go to the hotel and have the 3-day package.
Right.
Cute.
Because
So
they get weighted on hand and foot.
So
And
let's talk about the shots.
okay.
So I come in. I know I keep talking about myself, but I'm the only one I know about. I come in and I get the IV, and then you give me all the shots.
Right. So right now we have 4 vitamin booster shots that we give. We have one that is an energy booster that's B12, highest quality, strongest of the B12 vitamins, methylcobalamin. We've got MIC, which is our fat burner. We talked about that earlier. We've got glutathione, that is the mother of all antioxidants. It's an antioxidant, anti-inflammatory, helps with hyperpigmentation, inflammation, swelling, acne. And then the final one we have is biotin. And a lot of us take biotin orally. This is just a supercharged biotin, and it helps to strengthen the keratin infrastructure of hair, skin, nails. So it's kind of our beauty shot.
I think my eyelashes have gotten longer since I've been on biotin,
I don't doubt it a bit. Yeah.
which is strange.
No, because that's kind of what, one of the reasons we take it, to strengthen hair, skin, nails.
But
So-
you've never heard that before, though.
Oh, I have. I've heard that. And I've also had a patient that said, I've got to get off my biotin shots because I'm literally growing hair everywhere. So much hair. Yeah. I said, that sounds like a great problem.
Too much of a good thing.
Yeah, right.
Well, maybe Grady needs some. What's it mean when it says on your website push? When it's talking about the shots, it says something about push.
Right. So sometimes if you're already getting an IV, we don't have to stick you and do an IM injection. We can just add it to the IV that we've already started.
Yes.
And,
It's called
I-
IV push.
Yeah. And so I do want to also talk a little bit about that. People who are needle phobic, this is just like one little stick, and we don't leave a needle in your arm for an IV. It's a little plastic catheter. So anybody can have just a little stick to get their vitamins in a healthier way.
Except in you, Kerry, which if you're going to get IVs every day, like you said, we're just going to leave your IV in.
I want one. Well, can I just get a port?
We'll get a port fit in.
I wouldn't mind that a bit.
Yeah.
So it's helped enhance Shewmake's practice because he's been able to have these great results with your clients.
Well, I think it's concierge level stuff. And it's like people say, gosh, I thought I'd have to go to Beverly Hills or Miami to get this. And in fact, we have patients who say, I had planned to go to Miami to get this operation done, but I heard you were doing this. So I think it elevates, I think, my patient experience. And and patient outcomes. And I think it's just one more thing that helps you sort of separate yourself from everybody else that's doing it.
Are y'all offering Ozempic?
So we are looking at, I'm not as big of a fan of semaglutide and tirzepatide, but
Is that Ozempic?
it's just a different way to do that. So, but we do have Zen weight loss boot camp, that we are going to start doing. So that is not vitamins. It's not all natural. This is a whole different category, a lot more health history, only short time use.
What is it? What is it going to be, the boot camp? Is it going to be Ozempic?
Well, it's not the trade name Ozempic.
Right.
So these are things that are compounded. And so there are different avenues of that, we're kind of looking into, because there is a need for that in patients who just have this stubborn weight that they can't get rid of.
Absolutely.
But the way, Dr. Shewmake does everything is kind of the best of the best. And these clinics that pop up everywhere that you just send them home and do these things, that's not something, that's such a low touch model. And we would do it as a more high touch model where we brought them in every week and we actually consult with them. We weigh them in. We talk to them emotionally, make sure that they're having vitamin supplements and physically and emotionally are doing great. And a super short time use thing for us, because we want to also educate them that if they're not eating correctly and exercising more and they take this short term and come off of it, the weight is going to come right back. So we're much bigger believers in a healthier lifestyle and just changing the way you eat and exercise, and much bigger proponents of
like
vitamins.
Shewmake was saying, though, you can't get your vitamins and nutrients and eat well today. Even if you go into the fresh produce section, that's come from the other side of the world on a truck, was picked.
Exactly.
It's not healthy. I am a huge proponent of canned vegetables.
Right.
They're just salt and water.
Right.
And if you don't get the ones with sodium chloride, they're just regular salt and regular water and green beans. And they seem to be locked in freshness because they're picked at their ripest stage.
Right.
So is part of what you would be doing is talking about how to eat foods and how to, you can eat. People say eating healthy is expensive. Eating food is not expensive.
Right. Well, I think they mean more like eating organic. So without chemicals and pesticides and hormones in your meat and in your fruit and vegetables. So yes, a big part of it is education, food diary, teaching them more about health and wellness. And that's why we believe in supplementing with vitamin infusions and booster shots, because the soil does not have time to replenish to make our foods what they need to be with the nutrients.
So I think
I think a lot of this, I've been reluctant to jump on this bandwagon because I just don't want to be, I think we don't know the downsides yet of
Ozempic.
Of Ozempic type, medication related weight loss.
I thought it had been around for 20 years.
For diabetics, yes,
Right.
not for just the average person who wants to lose 20 pounds.
Right.
So, what I've seen and what I think in our plastic surgery world we've seen is patients who just can't stop. And I've got patients right now who I've done stuff on who've lost 60 pounds now. And it looks like they've never had anything done. It's called Ozempic face. It's where everything just melts. And so,
You mean they lose so much weight that their skin sags?
Yeah. That's one of the things that really accelerates the looking older is massive weight loss. The good news about losing 100 pounds is you're healthier. Your joints don't have to bear that weight. Your blood pressure gets better. Your blood glucose gets better, but you just deflate your body and it just hangs. I mean, it happens everywhere: breast, face, tummies, thighs, everywhere. And you can take, just like anything, if you can stop when you get to an ideal body weight, but a lot of these patients can't. They just keep going and they
losing too much weight.
And they look sick and they're not healthy. So now that's an extreme, but the pendulum, I'm kind of waiting for the pendulum to sort of settle as to who's a good candidate for it, who's not a good candidate for it. And it's all about education and having somebody that I've seen patients who've lost 60 pounds and I'll say, they'll come in for surgery and I'll say, well, now, where are you from your weight standpoint? Are you kind of happy where you are? Oh, no, I'm going to lose 40 more pounds.
Like, then wait for surgery.
Well, absolutely. Absolutely. The worst thing for an operation that I do is for somebody to lose significant weight afterwards because it just doesn't hold up.
Mm-hmm.
So is there anything we haven't talked about before we wind this show up? We know how to contact you.
Right. ZenInfusionIVTherapy.com. So
go look around in there.
That's right.
Go look at Raeann. She's pretty. And then thank you, Dr. Shewmake. No, I'm just kidding.
No, she was pretty before.
That's your excuse, Mom.
She was.
Yeah.
And then the listeners go look at all the different options, and you can drill down in there and see what's in them. You can Google those biotin and all the ingredients and see what they do for you and pick out one that you really like. And I promise you, if you've got the money and you can do it, it's life-changing. It really is.
Well, thank you so much for having us.
Yeah.
We love y'all.
Thanks for inviting me. You didn't need me, but thanks.
No, she felt like you needed to be.
She's got it.
Yeah.
She's got it. She's passionate about it.
Yeah,
You can really, really tell. This show was recorded in the historical Taborian Hall in downtown Little Rock, Arkansas, and made possible by the good works of flagandbanner.com, Mr. Tom Wood, our audio engineer, Mr. Jonathan Hankins, our videographer, daughter, Miss Megan Pittman, production manager, and my co-host, Mr. Grady McCoy IV, a.k.a. Son Gray. To our listeners, we would like to thank you for spending time with us. We hope you've heard or learned something that's been inspiring or enlightening, and that whatever it is, will help you up your business, your independence, or your life. I'm Kerry McCoy, and I'll see you next time on Up in Your Business. Until then, be brave and keep it up.
If you enjoyed this video, don't forget to like, share, and subscribe. For more of Kerry's interviews, click on either video on the right of the screen. And as always, thank you for watching.